This is going to be the 4S for the shoulder. So 4S stands for spica, sling, swat, and support. This will help when you're going through your wrap to make sure that you are performing the correct motions. For this one, you want to use a double ace wrap. Again, it doesn't matter if you use a 4 or a 6 inch. It's going to basically depend on the size of your athlete. Your 6 inch will give you more coverage. It will give you more support, but sometimes the 6 inch will try and slip off the shoulder, so a 4 inch may be more acceptable. The position that your athlete is going to be in will be here. The arm is going to be tucked into their body. And now we're going to start with our spica. Now we have to keep in mind, these athletes are in a lot of pain. This is a tape job that we're going to use to keep them stabilized whenever they have something going on with their shoulder, whether it's an AC joint separation or a subluxation that we're waiting to transport to ER. So you want to try and keep the movement of their shoulder to a minimum. So one thing that you can do to help start your spica is pull out some ace wrap and just glide it to start your anchor instead of trying to slip this entire ace wrap in between their arm. So we're coming around the chest for our spica. Now, we have our spica. Instead of coming around the forearm like we would, we're going to come down for our sling. We're going to perform 2 slings. And then we're going to come around back over the chest. Stand for me. Now, instead of coming back up the back like we did earlier, we're going to come on the lower back, so that we can cover the arm for the swap. And we're going to continue our wrap around the arm and anchor. And then we're going to take our power flex and we're just going to go around the swap. So have your athlete hold there. And we're finishing here. So you can see you have your spica, your sling, your swap for a total support. Yes, always make sure to leave pinky and thumb out to check for capillary refill. We want to make sure that we don't have any neurovascular compromise happening at the shoulder. So always leave those 2 available so that you can check for capillary refill. Thank you, Kevin.